Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. First of all, I want to thank all of you for your support because today is the 100th episode of Clinical Ayurved by Dr. Mayuresh Agte, and we have completed our journey of 2 years today. So, I thank you again, all of you, for your support, and I hope that our journey will go further for a long period. Thank you very much. In this journey of 100 episode, as I told you in the first few episodes, in the first episode of the series, that my aim and my try will be to focus only on the clinical evaluation of a disease or principles or in general Ayurveda. Hence, you will hardly find in these all episodes of or 100 episodes that I have hardly spoken any shlokas or I have hardly given the references of Tika, and in Tika this is the word and this is the in Sanskrit this is the meaning, so the meaning of that may arise like etc etc. It is nothing wrong in that, but I have purposely avoided these things because it is seen very commonly as you go deep in the wordy nature of Ayurveda, you became more and more theoretical and practical aspect remains far behind. We have we see in daily routine of in Ayurveda field that it is very interesting to read Tika or to mug up different granthas and compare them about any topic, but this comparison may lead to more theoretical evaluation than practical evaluation which we see in the living patients. I am not criticizing anyone and I am not saying that uh, being theoretical is wrong, but it was my view that I should focus mainly on the clinical points which we observe, experience in the clinics, and we have to face the problems which we see in the patients, we have to tackle them and we have to cure the patients. Hence, in all this journey of 100 episode, I was I refrain from the more theoretical references or evaluation and I just focused on the practical points. Hope you have enjoyed it as well as you have liked this, and hence we have reached this milestone of 100 episode and a journey of 2 years. So thank you very much again. In future also we will focus on the practical things more as it is our aim of this series, Clinical Ayurveda. Okay. We were discussing Androsotas and we have discussed about Atisar, Chardi, Malavrud. So, in that regards only, we will take a small topic which is very commonly we come across, and it is Parikartika. What you can say is a fissure in ano. We had discussed Malavrud in Parikartika, definitely Malavrud is one of the major hetu, and because of this Malavrud there is staining during the defecation and that friction of fecal matter daily with the anal canal then comes as a hetu of the Parikartika or fissure. We all know that. And in addition to this, Rukshanna Sevan, lack of proper water intake, sitting job add to the hetus of this Parikartika. So, nothing new in that. In practice, many a times these patients have blood which is along with the fecal matter, and they get frightened because of this blood coming during the motion. Most of the times they are advised for the operation, and because people are so frightened because of blood and so much pain after the defecation, they always think of the operation. But with our practice, and it's my experience that we can avoid the operation of fissure very well, and that too we can give the results in time. Now, what is the fissure? There is a spasm of muscles in the rectum, in the anal canal, because of the constipation or etc. And because of friction, there is a fissure, means there is a wound. So what will be the our aim of treatment? Just to relax that muscles in the anal canal, take the care of constipation, which is uh, one of the most important hetu. And third one, fissure is a wound, so heal it. So prana ropan will be the third line of treatment. So in practice, always give a good variation. Yes, here you have, in last episode of Malavrot, I have discussed that you should think of the Koshtham, Vaya, etc., history of the constitution, then choose about Anulaman, Stramsan, Bhedan, etc. But most of the times, in these cases, there is a very strong history of constipation, and you have to make the motion so clear that many a times you have to give a very high intensity purgative or even variation, that too on a daily basis. So this is the first level treatment. And for fissure in anal to heal, runner open karma, I use gestamal with ghrutta and apply it on the anus region. Always ask the patient to apply after the motion, that too not only externally, but ask him to apply as much as possible internally also. To relieve the pain, it is very common that sitz bath is always useful. So the three line of treatment: give a strong variation at night, so patient can get loose motion, there will be no constipation, and because of that loose adravata in the mala pravritti, there is no friction with the anal region. First thing. Secondly, immediately after the motion, or even when patient gets time, have sitz bath, that Ushna Sweda will relieve the muscle spasm. And thirdly, to heal the fissure, Pranaropan Karma, Yashti Madhu with Ghrutta, which I use, but you can use any drug like Sariva, plain Ghrutta will also do, or the Pranaropan tail is also useful, Jatari tail is also useful. Choice is yours. So Parikartika with this line of treatment, variation, which will give the Dravamala Vrutti and no friction, Pranaropan Karma, and Vedana Sthapan by the seeds bath, definitely cures fissure, and operation of the patient is definitely avoided. To avoid the recurrence of the fissure, which is a possibility, you have to ask the patient to take care of constipation, and that ahar vihar which I discussed in Mayuresh chapter lectures. Just ask them to follow that ahar vihar and take care of a good soft motion daily. So this is about the Parikartika. We will meet with the next chapter, next Vyadhi in the next lecture. Again, thank you very much for your support, and because of you only, we have reached 2 years, a long period, and 100th lecture of Clinical Ayurved by Dr. Mayuresh Agte. Thank you very much.